Hi everyone, and welcome back to the CAPS nursing classes. So in today's video, I'm going to cover what to study and what not to study for your NCLEX examination. It could be for NCLEX-RN and also for the NCLEX-PN as well in the same video. Now, I'm going to split them by the subjects in this scenario, so it's easy for you to see what to study in fundamentals and what to study in medical surgical in each unit as well, right? Now, please remember, this is just as per my experience, which I think what is the most important to read for the examination and what is the least important, which you can just either just look at maybe only once, or either you can skip the topic if you do not have enough time to read before your exam, right? Now, let's start with the fundamental first, but before you start it, let's have a Saunders book with you as well, because I'm going to cover page by page as well at the same time. I'm going to flip the pages for you and also tell you how to read from the Saunders book and remember the Saunders content as well at the same time in this video. So watch this video until the end, I would say. Now, let's get started with the fundamental first. In the fundamental, I can see in the Saunders book, we have unit number 2, 3, 4, and 5. Unit number 2, 3, 4, and 5. I'm going to tell you the name of the chapters also at the same time, so it's easy for you to see which chapter or which unit I'm talking about, right? So the first one in the fundamental is ethical and legal issues. Ethical and legal issues. This chapter. And the second chapter is prioritizing client care. Now in the prioritizing, they're also talking about like delegation, and they're also talking about leadership, emergency response planning as well. In both these chapters, try to cover as much as possible. Do not skip any single word, I would say, because in my opinion, everything is literally important here, and the question can come out of from any of this page. And the questions at the back of these two chapters, do not skip them as well, because it's very, very important, I would say. Now, a lot of times students don't know how to read this information. So let's give you an example. I'm going to the ethical and legal issues chapter here. So let's see what they talk about. In this chapter, they basically cover, like I can see the definition of ethics, and then what is morals and ethical principles, and what is the meaning of ethical dilemma, and so on and so. Remember, the NCLEX is not going to ask you the definition of ethics and definition of ethical dilemma. If you already know the meaning, it's okay, you can skip this, right? The next one, they have like the regulation of nursing practice, and in this one they're talking about, okay, this is regulation of nursing practice. They're talking about some practice act, some employees guidelines, standard of care, hospital staffing, how do we do floating, disciplinary action. This topic will be skim and scan, I would say, at the same time. Just try to understand the meaning a little bit. When you read this information, just understand in simple language what is the meaning. Do not try to cram any information, because NCLEX is not asking you exact same definition in the exam, right? And then you have the legal liability. In this one, they're talking about some laws, types of laws and everything in there. Good Samaritan laws. Yes, you need to know all this stuff for the examination. Always, whenever there's a boxes in your book, do not skip them, right? Any box information, anything in red, anything in triangle, you must need to know for the exam, right? And then they talk about some legal risk area like assault, battery, false imprisonment, defamation, everything you need to know for sure. But how to read them? As I said, for example, it says here, assault occurs when a person puts another person in fear. So you try to basically understand the meaning of this language in a simple language at the same time. Like, okay, one person is trying to make fear to another person. That's it, right? And then after that, do not cram the information. Just remember the easy term, which you think it's the meaning look like for this definition. And this is how you remember this simple definition, what it is in here. But I'm gonna make a different videos on this one too. Pretty sure I'll bring very soon on the ethical principles, which tell you how to read the ethical principles and how to remember them at the same time. And then you have client rights, even the rights for mentally ill and everything. Okay, everything is important, damn important. Informed consent, very, very important for your exam, I would say. And then you have some health insurance portability and accountability act. Yeah, everything you need to know. I would say in this chapter, nothing to skip basically. They're talking about some incident reports and then example of incidents that needs to be reported, telephone prescription guideline, do's and don'ts documentation guideline. Everything is important, I would say, in this chapter. What is advanced directive and everything. So yeah, read everything in this chapter, right? And let's say sometimes you do not understand the information when you're reading it, right? And you're really looking for some help, like who can explain you this topic and so and so. Obviously, there are lots of videos available on YouTube as well. If you want to maybe refer another videos on YouTube as well. But still, if you do not understand any information, you want to understand in a simple, easy language, you can always connect with me on the WhatsApp as well. I already created the free classes WhatsApp group where a lot of students are participating and they're asking me all those questions. So if you want to participate into that group as well, feel welcome. I'm always willing to explain you any topic as well for your exam. And then the questions at the back of this chapter for sure, as I said earlier, right? Now, the next one is prioritizing care chapter. In this one, they're talking mainly about the case management, managed care, what it is, right? Who is the case manager person? So kind of standard definition they give you at first. And then they talk about what is team nursing look like, what is a client focused care look like, right? Skim and scan this information. But yeah, you really need to know the different type of leadership styles. Like what is the difference between autocratic and democratic style, right? Or situational between bureaucratic style with the examples as well. And then, yeah, lots of things is in here I can see in this chapter, like evidence-based practice. What is the meaning of evidence-based practice look like? What is the quality improvement meaning look like, right? So you basically skim and scan all this information, right, in this chapter. And then in this chapter, they talk about some delegation, some prioritizing guidelines. Yeah, everything you need to know. Emergency, department rights. So basically, I cannot delete any information from here. I highly recommend these two chapters for sure at the end of the day, along with the questions at the back of them. Now remember, when you're studying for fundamental, basically, it's more like a practical thing, right? How you basically apply in everyday scenario when you start working as an RN on the floor. So read the information with the interest, not with the cramming, I would say. Like as I already said, in a simple, easy language, this is the easiest way to recall stuff in the exam. And also know the things like how to apply them in a practical situation too. For example, the prioritization, right? As I already teach in the previous video, how to handle the prioritization questions, right? So those kind of the practical stuff in this fundamental. Fundamental is not about like diagnosis, disease, condition and everything you need to remember. It's also about the nursing procedures at the same time. Nursing procedures in the Saunders 9th edition, there's a complex care unit at the very end of the book. That is also the part of fundamental, just so you know. And the complex care, do not skip it. It's again very important. The whole chapter talks about the nursing procedure, especially the international graduated nurses. You really need to know that chapter as well, because there's a lot of difference between the nursing practice between the Asian country and the developed countries, right? So I highly recommend it to read those chapters and try to understand how the procedure look like in these countries when we start practicing in countries like US, Canada, Australia, and so on, right? So this is about for these two chapters. Now definitely use the comment section below. If you have a question for me, don't feel afraid to ask any question, because that's why I'm in here for. Now moving on to unit number 3 for the fundamental. I would say fluids, electrolytes, definitely important, but hardly 2 questions max. Especially don't forget to study potassium in this case, and also calcium after that. And after calcium, then sodium and magnesium is okay, still need to know for the test. Not just for the test, because you really want to study in such a way so you be a good nurse after you having a license, because at the end of the day it's all about your license and by yourself when you're working on the floor, right? So you really need to have a good knowledge about it. And I always tell the students, like, if you have lots of time for the exam, then you don't need to follow this list, like what to study, what not to study. If you can study as much as you can from this book, just go ahead, because this is a Bible book for this examination, right? And it's a lot of good information here, as I said. Even when you start practicing as an RN or as an LPN, it's really good for you, like this book, to look at it, information, and how to apply it in the practical on the floor, right? But if you have less time, this is a kind of cheat sheet for you, what to read, what not to read, right? Now, acid-base imbalance, hardly 1 question, usually, most of the time. So read little bit, not too much, I would say, this chapter. But both chapters, fluid electrolytes, like, which is the chapter number 8, I can say, I forget to write it down. It's the fluids and electrolytes, right? And the other one I talked about just now is the acid-base imbalance. In these 2 chapters, like, do the questions at the back for sure, I would say. Even if you're not reading much information inside, you still have to do the questions at the back. Now, chapter number 10, 11, 12, 13, and 14. This chapter, basically read, skim and scan information everywhere. Not too much in detail if you have less time left for your exam, okay? But questions at the back for sure, okay? Why read the less information? Because it's hardly few stuff you need to know here from these chapters. So read this information. It's kind of least, you can say, I'm not gonna say very least important, because still you need to know the vital signs normal for any of the age group to do your case study or the questionnaires, right? You still need to know some basic nutrition information for some diagnosis too, right? And similarly, you really need to know the IV procedures, what is phlebotomy, what is infiltration, all those complications as well, and what to do first in those cases, right? And what to do next. So all those sequences, right? So basically, I'm not trying to say just like superficial reading, right? You do superficial reading also, but read little bit as much as you can. Depend when you're writing exam, right? But if you have lots of time, okay, 1 day on each chapter, and not a full day, I would say. 2 hours max is enough for each chapter. So that's all about for these chapters until 14. I hope I make the job easy for you. The chapter number 10 to 14, just a little bit, I would say, okay? Now, there's a fundamentals of care chapter number 4, sorry, unit number 4, right? I should say unit, it's the unit number 4. In this one, again, not just the unit 4, I would say unit 5 also at the same time. Same thing, for unit 4 and 5, superficial reading, right? If you have less time left for your exam, and do the questions at the back of each chapter for sure. Like I always say, even if you're not reading the chapter, you still need to do the questions at the back of them, because you still need to know what the exam question kind of look like, right? And it also helps you to test your knowledge at the same time. If you're scoring, I would say, less than 70%, it's better to read more about this chapter. But if you're scoring already more than 70-80%, you know a little bit in there, right? So this is how you're supposed to study, or sorry, what to study in the fundamental, right? Now, as I said, how to study, it's a practical thing. So think as a practicum wise when you're reading this information, okay? If you're a visual person, maybe you want to watch some videos too on the YouTube. For example, IV insertion procedure, right? But if you have less time, it's not a great idea to watch the video, because then you want to practice more questions maybe in there and read about the rationals and learn something from the rationals out of it, right? So this is about the nursing fundamental, how to read information. And the last thing I forgot to mention is every nursing procedure is important, and for each nursing procedure you really need to know which procedure you can delegate to the LPN also. The LPN can also do it, or which procedure the RN needs to know as well, like something in both of their scope of practice, right? That's something comes under the delegation part as well. So try to correlate the things when you're studying for the fundamental. And the last thing, as you know me, I always say something you don't understand from this video, better to leave a comment for me on this YouTube channel or WhatsApp group, whichever comfortable for you. I will be very happy to address your question, right? Now that's about for fundamental as of now. Now I'm going quickly on maternity section. Okay, well, maternity, I would say leaving the first chapter, reproductive system, the rest, every single chapter, like except the reproductive system here, because it's in reproductive system, they're just talking more about anatomy and physiology. If you already know that information from your graduate nursing school, you don't have to read that information, right? But if you don't know the basics, you can read that skim and scan, but question will not come much from there, just so you know, right? Now, what else to read in fundamental? A lot of times students ask me, ma'am, can you tell me specific about the maternity, what to read? I'm going to tell you literally every single line, okay? I'm not going to skip anything, just so you know, from maternity. Because there's a 5 pillars I personally believe the NCLEX mainly is about in your exam. The first one is fundamental. For sure you need to study. Second is maternity, okay? Number 3 is mental health. Number 4 is cardio. You really need to know the cardio for sure for adult. And then endocrine system, right? These 5 I always take as pillars, basically main pillars for the exam, okay? So maternity, I cannot skip anything in there. Like you really need to know, and literally every single page is very important there, and it's very interesting. Read that information please, and do the questions at the back of this chapter. So I'm not going to pull what to read in maternity, because everything you're supposed to read in maternity, right? Similarly, mental health, what to read in mental health as well, right? Sorry, the one thing I want to maybe make an easy job for you in the back to maternity section. If you do not want to read the whole medications about maternity, it's okay. But at least read the basic medication. For example, oxytocin. Don't forget the oxytocin to read. Magnesium sulfate, purpose of magnesium sulfate in maternity clients, right? Opioids in maternity. So at least don't forget the basic medication, betamethasone. So those medications you still need to know in maternity. And after that, there's a lot of other meds in this book as well. If you don't have enough time for your exam and you're looking for something fast and quick help, then this is maybe cheat sheet as I said. But if you have lots of time, you want to read about other meds, go for it, right? Now, before I jump to the mental health, I apologize, I forget to mention one thing in here in maternity, how to read maternity actually, because I want to cover at the same time as well, right? Maternity, for example, let's say any condition, for example, let's say placenta previa, abruptio placenta, for example, or shoulder dystocia, right? Or umbilical cord compression, whatever. So any of the disease condition, whenever you are studying, again, don't cram it. How you should read the diagnosis, disease conditions and everything. The easy method to read and remember for a long time is, first of all, look at the meaning of the disease condition, like kind of definition. You're reading it, but you're trying to understanding from definition what it is basically look like. So if I give you a live example right now, I'm just gonna go to my chapter here, maybe problems with the labor and birth. Let's see what is in there, or postpartum period. So let's see whichever comes first. Okay, I think I pulled the problems with labor and birth now. A good example, the one I just talked, placenta previa, it's in front of me now. So for example, you're reading placenta previa, and now how to read it, how to remember this placenta previa. So first of all, when you read from the book, see the first line, they're talking about it's an improperly implanted placenta in the lower uterine segment. So you see the photo which they give it to you, and you see the lower uterine segment in there, right? And it's an improper implantation there. That means it's not at the right place, right? And then they're telling you about either it's near or either it's over the internal cervical os, right? So you see those 4 O's and understand from there at the same time, like, okay, if it's near, where it look like near, where it is look like over. And then once you understand the definition, meaning, picture, visualize something, then they tell you these are the different types: total, partial, marginal. Now NCLEX will not ask you the question, how many types are there in placenta previa, A, B, C, D. No, if you're getting that question, no way, it's a below the level line question. You should not expect that in your NCLEX exam. You need a higher level paper to pass this NCLEX test, right? So difficult level paper, not something, a knowledge question which every nurse know in the world, right? Now once you read the meaning of placenta previa, then look at the assessment. Like if you have a patient in front of you with placenta previa, what symptoms are you going to check in that mother, right? Or the woman, right? So basically they tell you the symptom here, like sudden onset of painless, okay, bright red vaginal bleeding will be there. So you read with interest, you know, okay, I'm gonna see this symptom in her, in this symptom in this person, in this client. So basically you see this kind of information in there. Now what you do as a nurse for this person, so think as a RN, if you're writing RN exam, what you do as an RN in nursing intervention, or if you're writing LPN exam, what do you do as an LPN as well in this condition, right? So am I going to check the vital signs in this case because there's a lot of bleeding in there? Yeah, the answer is yes. Should I check the fetal heart rate as well, fetal activity? Try to understand why you're doing it along with the symptom. Don't just cram everything, okay? And also, when the symptoms are there, why symptom this one is there? For example, why is uterus is soft and relaxed? Is that indicate something is bleeding inside is happening? This is how you should think when you're studying for this examination. And now once you study in this way, what it is, what the symptom look like, what I'm going to do as a nurse in this condition, then you try to correlate this condition, you know, with the medications also at the same time when you read the medication. Okay, what medication I can give if I have this kind of patient in front of me, symptom, what medication should I give? Is she also going to be at the risk for infection too? Should we also start the antibiotics or not in this case? This is how you should correlate 360 degree, because at the end of the day, you're going to work as a nurse on the floor. So you really need to be confident, right? Now, this is the example, live example. I wanted to show it to you how to read maternity. Okay, so don't just open the book and cram and make everything notes out of it. No, try to understand what is in there, right? Once you understand, you revise 2-3 times this book as I talked in my previous video, then make the notes out of it and see what you need for this exam. Now, questions at the back of each chapter, you must need to know for sure, okay? So this is about how to study maternity and how you can remember maternity, right? Now, one thing, I think students also want me to cover up here at the same time in maternity, how to read the medications, how to remember the medications, right? So let's talk about that maybe at the same time using as an example. Maybe I'm gonna pull the medication chapter now of maternity and let's see how to read this information. Okay, so I open the chapter maternity and the newborn medication chapter. I can see there is a tocolytics, magnesium sulfate, and betamethasone, opioids, prostaglandins, oxytocins, which is oxytoxics, right? Lots of information is in here. Now, when you read the meds, I'm going to take an example of oxytocin, one of the important drugs for sure in the exam. Now, when you read the medication, I would say not just maternity medication, any medication when you're reading for the exam. Let's see how to do the meds. Now, because a lot of people I know, they hate pharmacology. You're gonna love pharmacology, right? I'm just gonna use on this side maybe how to read the pharmacology, right? Or remember for a long time. Taking as an example of oxytocin in this case. Now, the first thing, when you read about any medication, remember, the first thing is what? Purpose. You really need to know the purpose or the use of the medication. Like, what is the purpose of this medication, right? What is the usage? Where I'm going to use this med? Once you know the purpose of the medication, the second thing you need to know if there is any classification of this medication as well or not, right? So any medication, as I'm saying, I'm just taking example oxytocin right now, but it could be any med for the exam, right? Think if there is any classification of those medication has, right? If yes, what it could be, you make a small little tiny list for that. Then after that, is there any common names of the medication, the generic names that can comes under this type of medication, right? So for example, everybody know like in beta blockers, everybody know about the LOL medications at the end. So any LOL at the end, it's all about the beta blockers. But oxytocin, I already pull up from the uterine stimulant, so it's already a part of it. I'm not gonna say the name in here or the classification in here, that doesn't apply. But yes, the purpose, what it is, right? So what is the purpose of the oxytocin? Basically, it's just going to stimulate the uterus. Basically, stimulation, increase the uterine contraction. This is how you should think. Make a one-word cheat sheet always when you make a pharmacology note, small little notes for yourself, okay? So you can remember pharmacology for a long time. Then once you know purpose, classification, any names comes under for that meds, then after that, what you need to remember is any side effects or any adverse effects of that medication. If I give this medication to a patient, you need to know, because if something happened, what are you going to do there as a nurse, right? And you also need to know what is the difference of between side effects and adverse effect. Remember, side effects are the one which are the expected after taking a medication. And adverse effects, you're not expecting them. They could be dangerous as well, just so you know, right? So you really need to know, first of all, what is the difference between side effect and adverse effect. So it's easy for you to pick up the answer when you get, let's say, for example, SATA question on this one. They're asking you, let's say, side effect of the oxytocin medication, and there's a lot of options there, and it's a SATA question, right? Now here I can see in the book, let's see what side effects they give it to you and adverse effects they give it to you. If I give you some options out of it, right? So they are talking about here, let's say, changes in vital signs. What do you think? Changes in vital signs. Is this a side effect or is this the adverse effect? It's a side effect because changes in vital signs is expected a little bit after taking a pill. But what if I told you that patient got dysrhythmia? Is it expected? No, not expected. So that goes to your adverse effect, right? So this is how you should think when you read any drug information, right? Side effect, adverse effect of that medication. Now, once you know the side effect, let's say, for example, changes in vital signs, right? What do you do as a nurse for a patient when there is a changes in vital signs? That will be a nursing intervention, right? Or what do you do as a nurse when your patient has a dysrhythmia? That will be your nursing intervention. So don't cram anything from the book. Try to correlate 360 degree, right? So you remember the information and make it as an interest in your brain, because you really wanna remember this information for a long time. The drugs for sure when you're working as a nurse on the floor, right? And I would say cramming will not work, right? In any case. So try to study with a more interest like this, like purpose, classification, and then, as I said, any names under come of this particular category. But right now there was not under the oxytocin, as I already said. Then if there is any side effect, adverse effect, right? And then after that, you need to know the nursing interventions, right? Now, discharge teaching. let's talk about discharge teaching too, because most of the time student cannot find discharge teaching in any of the books, right? So what could be the discharge teaching for a client when there's a changes in blood pressure as a side effect, right? Definitely you want to teach the patient how to check the vital signs at home. What is the normal value look like for blood pressure, for a heart rate? When do they have to report to the doctor if the value is this and this, so and so, and what number they should supposed to call you, right? This is how we create the client teaching, right? Or the patient teaching when they're going home, or discharge teaching, you can say, right? They are also very important, but you can only understand them if you know the nursing intervention. And nursing intervention you can only understand if you know the side effect and adverse effect. You can only know the side effect and adverse effect if you know the purpose of the medication. Because if you do not know that it does stimulate the uterus, the oxytocin, then how would you know what it does expected something inside the body? So everything is correlated. Try to study with this method, and I can guarantee you, you're never gonna miss the medication pack again in your exam, even also when you work as a nurses on the floor, okay? So now, that was a little bit side topic for sure. I know I pull it up, but that was indeed, because I know a lot of nurses, they're looking around for this information, how to do it. Believe me, I never really reread information again and again from the books, because it's all in my brain, like what to do, what not to do in this case, right? Because this is how easiest method I use for myself, and I want to give it to you too, so you can also apply in your practicums as well, and also for your examinations too, right? Now, that's all about for maternity. I don't think so I left anything in there now. Now, the next one is mental health. In mental health, what to read? I would say everything you need to read back again in mental health, because it's one of my pillar, as you can see, right? But I can make an easy job for you in terms of medications. Medications, if you do not have enough time to read all the meds, that's okay. But at least read about antidepressants for sure, right? And mood stabilizers, lithium for sure, if you don't have time to read all meds. But all the meds are also very important. I'm not saying they're not important. Everything in mental health is important, but if you're watching this video in the last minute of your exam, you want something shortcut, those two meds maybe, right? But still, try your best, do all the meds if you can in this mental health as well. So mental health, everything is important. And how to read the mental health? Same method. How you read the disease condition. You know the diagnose, what is in there. For example, what is anorexia nervosa, right? Meaning of anorexia nervosa. Why patient has this symptom in anorexia nervosa. What I'm going to do as a nurse is in there, right? So this is how you should read and understand the mental health as well at the same time. Similarly, how to read the drugs, same method for the mental health as well. So I'm not going to repeat this information again. I hope you guys understand. The same method will apply in mental health as well. But again, if you have a question, leave in the comment section for me. Now, moving on to the medical surgical side, I'm just going to raise this one a little bit in here so we got some space. In medical surgical, I'm going to actually go not as per the book, but the most important units I will write down on the top, and then the least important I will write down at the bottom for you. So it's easy for you to understand what to read first and what to read next. I always suggest in medical surgical, start with the cardio first. Heavy unit for sure, but you need to know that for sure. So first one, I'm gonna say cardio. Then after that, I recommend to read respiratory system. Then after that, I recommend endocrine system. And after the endocrine, then you're gonna read the musculoskeletal system. Try to read this system along with integumentary, because it's very small unit, integumentary. So plus integumentary. After this, you need to read nervous system, right? And then, neurological system. Then after that, neurological system, let's see what's the next one we left it here on the board. I'm just gonna go to your index right now and see if I'm missing something in here. Yes, we are missing the gastro, hematological, oncological. We are also missing GI, and then renal, eye, ear, and immune disorders. So I'm just gonna organize them in here for you. So after the neurological disorders, then you're going to read next GI system. And after the GI, you need to go to hematological plus oncological, because it's together in your book, right? And then after that, you need to go through, at the very last, I would say, renal, ear, eye disorder, and immune. 3 of them you can do in one day because it's not very important, just so you know, right? So renal, ear plus eye. Sorry for my bad handwriting, but I hope you guys are understanding my voice. You can always ask me in the comment section if it's in there, or replay this video if needed. And the last one is immune disorders. Now, basically, what to study in this one. I'm going to tell you briefly the most important topic here in each system, and the rest which I'm not mentioning in here, you read if you have time. You have lots of time for this exam, but again, if you don't have time, then you can stick with this list, okay? Cardio, I would say everything. Meds, every meds. Do not skip any single cardiac med. I'm repeating back again. Do not skip any single cardiac med for your exam. Very, very important. I know lots of students, they don't remember cardio. I'll bring the cardio system very soon for you and tell you how to remember it. It's really one of my favorite unit, and how to remember the drugs. I'll explain you drugs in a very easy way, those cardio, so you're gonna start love them, right? But cardio for now, everything I would say. Second thing is respiratory. For sure, you need to study about tuberculosis here, COPD, and then chest tubes. Don't forget to read chest tubes here. And then let's see if I'm missing something, just in case, right? So in my book, let's see what page it is going to be. Everybody maybe has a different edition right now, so maybe you have a different page number. I am getting a different edition right now. My page number is 708 right now, what I have for respiratory system. Okay. Tracheal suctioning, you need to know the procedure for that too. Thoracentesis, you need to know that too. And then lung biopsy test, really need to know pre-procedure, post-procedure too. ABG, you're already covering on the other side. You don't have to repeat in here. And then how someone can use the insect spirometry procedure, you need to know for sure. And then ventilator alarms, yes, you need to know them too. Respiratory failure, pneumothorax, I would say. Brief information on asthma, you need to know for sure. And influenza, pleural effusion, okay. Pulmonary embolism for sure, medical emergency, right? And tuberculosis, I think I already mentioned earlier on the screen. So yeah, questions at the back, always. That's it about the respiratory system now. Now, something which I did not mention here, I skip it. As I said, very least important, no important. You can skip it if you want to, right? That's about the respiratory system. Now let's go to endocrine. Endocrine, again, unfortunately, just like cardio, everything in there, okay? Everything in the cardio system, even the meds as well. But if you don't have time to read all the meds in the endocrine, at least corticosteroids, you really need to know for sure. So that's for the endocrine system, I can see as of now. Musculoskeletal integumentary, I would say here you need to know for sure. Hip surgeries, fractured hip, what else? Compartment syndrome, you need to know for sure. And then burn patient in integumentary, you need to know for sure. So yeah, those kind of very important topics, I would say. But if you have lots of time, you can read the other topics too, like dressings. You can also read about the dressings as well, but this is the mandatory, the one I just mentioned right now. Now neuro, the good news is, oh sorry, meds in muscular integumentary, I don't recommend it. I only recommend meds in here. That's it. That is a good news for you. Like first three. None of the meds after, I'm gonna tell you to read it. Why? Because it's a lot of meds. And if you start reading a lot of meds like this, remember, you cannot recall everything in the test for sure. So for that, these medication, the one I'm not gonna recommend it from musculoskeletal to until the end, you try to look at the strategies of pharmacology, how to handle the bouncer question with the medication name when you don't know the name of the med. And again, I'll bring the different lecture on this one too, because I think I have pretty much good hands on those questions. Without knowing the meds, I'll tell you how to find out the answer. So don't forget to subscribe the channel if you have not subscribed it yet, because I'm gonna bring those videos soon for you too, so you get the notification. Now, moving on to the neuro, good news is only 2-3 things. Stroke, head injury, right? Those kind of topics you need to read for sure, but if you get lots of time, you can read the other one. Parkinson's disease as well. Yeah, that's all I can say at the moment. GI, pancreatitis for sure. I would say GERD, hernia if you can. Yeah, that's mainly in GI for sure, but either if you have time. And then hematological oncological, I would say this one is more about like your cancer thing, like leukemia, right? So let's see the hematological oncological. I'm referring a book because if something doesn't come to my brain, I want to make sure I'm not missing to tell you actually, right? So let's see here. Now in my book, this is on page number, I have 578, but again, it's your book, it's a different page number, right? So 578. I would say radiation therapy. Yes, that's something I was missing for sure. Chemotherapy, radiation therapy. How do you handle radiation if in case accidentally it goes on the floor? Do you pick them with a forceps or what? Client teaching with the radiation therapy for cancer, very important. Leukemia. And in this book, I can see I think under leukemia, they have given to you really good information about the bleeding precaution. Don't forget to read that as well. Lymphoma, if you got some time, it's a good idea to read this. I don't recommend to read all type of cancers. No, cancer is cancer, right? Mastectomy, for sure. And then, TURP, CBI procedure. For sure. Stoma, how do you check that? How do you clean it? That kind of information you need to know in this, right? Now, the next one I have on my screen here is renal. Renal, I would say kidney failure. The rest, if you got some time, that's it. And then ear, eye, I would say cataract, glaucoma. Rest, if you got some time. And then we have immune system. Let's see the immune one. What's in the immune in there? I'm again going to go back to index in there. Sorry about that. And then 966 page number in my book. I know guys, it's a little bit longer video, but bear with me because this is gonna help you a lot, what to read, what not to read now from here, right? Because you don't want to waste your time maybe in there. So I'm almost there. Okay, immune system, I would say anaphylactic reaction, and then SLE, systemic lupus erythematosus, that's it. Rest if you got some time. Questions always at the back of each chapter, doesn't matter what system, what unit you're studying. And then now the last one we have in here, because I covered the medical surgical already. Last thing before I leave is the pediatric nursing. Now a lot of time the nurses, they read pediatric nursing as a separate after the medical surgical. Okay, no, you're really gonna confused, I believe, and you cannot apply all the information when you study too much, right? I highly recommend a very easy method how to do the pediatrics. So do the medical surgical units first, med surg, right? Once you finish them, when you're revising second time this medical surgical, simultaneously pull your pediatric at the same time, at that time, right? So for example, if you're reading endocrine system, revising it from the adult health, you look at the endocrine system at the same time of pediatric, because hypoglycemia is hypoglycemia, right, in both cases. So that definition is not going to be changed. But yes, you need to look at the nursing intervention in case of pediatrics. When the child has a hypoglycemia, what to do in that case, right? So when you're revising this, simultaneously for the same topic, revise the nursing intervention at the same time for the pediatric section. Similarly, for the other diagnosis too, in the same chapter or same unit. And once you finish, for example, let's say endocrine, then you move on to cardio. See if there is any different condition in the child related to cardio, something which is not mentioned in there. Only read those information. Otherwise, you don't need to read again and again, right? This is my advice for pediatrics. But for sure, questions at the back of them for sure. And read the pediatrics at the very last, I would say. Don't start with the pediatric nursing. Read at the very end for sure. Now, I think I covered up everything in there, what to study and how to study. In how to study, I only use the one method, and that goes to all the different chapters, like how to study disease condition, how to study a medication, and how do you remember them for the long term as well. So I think I covered up everything in there. So if there is any question, any doubt, something you think I missed it, and you really want to know if that's something you need to know for the exam or not, maybe you have a different other question for me, doesn't matter, feel free to drop the message in the comment section in here, and I will get back to you as soon as I can as well. Or either you can connect with me on the WhatsApp as well. I'll put my number in the description box for you. Okay, thank you so much for watching this video.